Time right now is 8:15. Your flexible spending account dollars will soon be expiring. Dr. Chaffoo is here with some tips for useful spending. Doctor, good morning.
Good to see you.
Okay, so let's talk about this. Does all the money expire by the end of the year? Because a lot of folks are a little bit confused about how this whole thing works.
And it can be kind of confusing.
Yeah.
You know, the bottom line, Raoul, is make sure you talk to your HR department. We know that there's, the FSAs, which are the, and then the other one is called the MSAs, and they're different accounts, and not all employers have the same one. So the big issue is that by the end of the year, it used to be that if you didn't spend it, you would lose it. However, Congress mandated at least $500 can be rolled over into the next year for a couple of months or rolled over for the entire year. But again, it depends on your employer's plan.
Sure.
So you really need to check out with your HR department to find out the exact rules.
So that $500 rolling over call the department and have them explain exactly how to do that, I guess, is the best way you're saying, right?
The best way to do it, exactly.
Okay, perfect. Let's talk about some different ways to spend your FSA account.
Sure. So the important things for people to realize is that that's tax-free money, and you can certainly use it for expenses, for instance, co-pays. You can use it if you want to go to your store and pick up, let's say, you need some contact lens solution, you need some prescription for glasses, even a prescription for sunglasses. LASIK surgery sometimes will be covered partially under that. There are certain over-the-counter medications like Pepto-Bismol, Tums, Clearasil for acne. There's actually, Raoul, an FSA store online where the public can go and actually see what's available, what is covered by the expense. If you want to buy a stethoscope, a new blood pressure cup, if you have diabetes, the insulin that you need, the syringes that you need for treating that are also covered. And then if you're getting you need to update your first aid kit. All of that's covered under most FSA plans, and sunscreens, so many different health-related benefits. But again, you need to check, and I think the FSA store is probably the go-to place for people.
I didn't even know that existed. Okay, so we got the teeth, the bling out your medicine cabinet, first aid. What about alternative treatments like a chiropractor, an acupuncturist, stuff like that?
So alternative treatments. For example, if you're having a lot of neck or back problems, you want to look at an alternative therapy with either a chiropractor or an acupuncturist. They are oftentimes covered under FSA accounts. So again, it's worthwhile to check out your policy.
Okay, managing your diabetes, you can also stock up on that as well.
Absolutely. So if you have diabetes, whatever syringes you use for the injection of the diabetes, the insulin itself, all those are certainly covered under your FSA plan.
Okay, good stuff there. I still like to get a stylish pair of glasses like you mentioned earlier, because you know what? Why not, if you can?
At the end of the year, right?
All right, great information. It's all this stuff. You don't want to lose your money, so you want to make sure you get all the information and you make sure you use that cash. All right, Dr. Chaffoo, we thank you for your expertise this morning.
Good to see you.
Merry Christmas.
Merry Christmas.